Welcome back from our brief break. Before we went off the break, we were talking about C-section. And if you've just joined us in the studio today, we have Lydia. She's sharing with us her story of what she went through to give birth to all her 5 children through cesarean or through C-section. It's not an easy thing. I think whoever has ever gone through it knows better what it takes to be there in the theater. For now, we are having Dr. inquired from him why most mothers go for C-section. Is it just a choice, or sometimes they have no choice? And this is what he had to say about C-section.
Hello everyone, this is Dr. Kenya, General Military Hospital, Horizon Medical Chambers, gynecologist. Nice to be with you today. C-section, we call it a cesarean section or cesarean delivery. It's a type of delivery that is done surgically to deliver a baby from a mother out of her womb. We have the classical cesarean section. We have a low vertical and a high vertical. So those one, it depends which stage you are going to do. So as you hear the word vertical, so you may find a mother is done a Caesar. We always classify this depending on the uterus, not on the abdomen. The abdomen you see is called incision, but the classic issue of the cesarean is depending on the uterus. So the vertical, we go in. You may find a baby has this, the mother has a baby like the one you see with the hydrocephalus. They have big head. So when you go low, you cannot get the head out. So make a classical vertical. So you cut vertically. So you remove the baby. It extends the space so that the baby can be easily retracted out. So then the lower is the common one. We always do classical or the lower one. So you always go down and you get that baby to normal babies. Others could be twins, conjoined. Those ones we hear they are born them where they are together. You cannot pull one, so you can make those vertical issues. To always depend on the result inside the baby. A mother always go through C-section with 3 factors. The factors could be maternal causes. It could be fetal causes related with the baby fetus, or it could be both. For example, if it is the mother, one, it could be due to mother's BP's pressure, hypertension. Classically, you have what we call PET, preeclampsia or eclampsia, can lead the mother to be operated and go a cesarean section. It could be due to her pelvis, what we call cephalopelvic disproportion, due to the bones, failed bones to contract. So what we call a contracted pelvis can lead to the mother to be operated. Those one you always see every time they deliver by cesarean section. It could be a factor. 3, it could be due to issues related with her cervix or uterus. So the mother's cervix may fail structurally to open. So when you fail to open, you will go for a cesarean section. It may be issues related with the fibroids in your uterus. You conceived, but you have fibroids. When you go for delivery, you may overbleed, so you can go for a cesarean section. Baby, it will be a big baby leading to you to do a Caesar. Position, malpresentation, baby is just standing, baby is just seated without facing the head down, baby is transverse, so you can go for a cesarean section. Baby may be getting tired. You've tried and the baby is tired, so whether you push, you may push a dead baby, so we allow you to go for a cesarean section. The mother is supposed to know why you are doing a cesarean section. Is it elective? Elective, it means is planned. So she has been on antenatal and then they tell her, you know what, according to ABCD, you are not going to deliver. However much you move here and here, you are going for a cesarean section. You plan for it. The mother should be prepared prior to Caesar. 2, he has to have what we call a consent. You have to make the mother, it is a must in capital letters, she has to consent. Even if you're a doctor, you don't need to force her to take her to operation. She has to understand and consent. That is a preparation. 3, there is what you call, you stop them to eat, what you call nil per hour. you tell the mother to at least 8 hours to 12 hours to starve before an operation to avoid those intraoperative complications. Then you put a catheter. This catheter is very good for two things. It does what we call continuous bladder drainage. Remember, the mother will have anesthesia, she will not be in position to move. Secondary, it will help you as a doctor to not overtake an incision into a bladder. So because you will palpate, you will feel it, so you will be safe not to open through the bladder such that you complicate your surgery. And lastly, she has to know the complications of the medications and how you are going to handle her pain during the operation. The risks during cesarean section, there is what you call the pre-risks. There is intra when you are doing the Caesar and post. So the major one that can go when you are doing a Caesar is bleeding. You can do an incision. Unfortunately, you pass through maybe the upper segment, or you go through a vein, the arteries, then the mother overbleed. That is one. 3, it could be related with anesthesia, the drug we give them to take away the pain, especially that spinal. The mother can get a high spinal or heavy spinal. So you end up the mother, the spine going into different zones, surfacing where you were expecting it to be. So it can cause pressure crashing. You crash the BPs, the mother, the BPs may go high and you get issues. Mother can get fetal death. You can lose a baby due to the cesarean section. The doctor, if he's not very active, those drugs can surface the baby and you get complications from there. Lastly, you can get pressures during the table, or you get hypoglycemic state. Those one are quick and acute states. Then post-op always you may get what we call secondary PPH. Postpartum hemorrhage, secondary PPH, overbleeding after cesarean section can happen after 24 hours and the mother overbleeds. You may retain the products. You retain products of the placenta, retain the products of the membranes, because you've done a Caesar, you were rushing, you didn't clear the mother so well, so she retains the products. Those one can lead to overbleeding. Then she gets infection. Infection is very, very common in cesarean people. You may get a burst abdomen, a wounded hensis, or what you call pupural sepsis secondary to cesarean section. You may even lose a baby, or you lose your life because of cesarean section. Yeah, after operation, the hygiene is very important. This hygiene could be done by the nurses, the attendant, before the mother, but the recovery how the mother can quickly recover is to get out of the bed so fast. When a mother is out of anesthesia, it means you no longer have that, the legs are now okay, they are back, you are no longer paralyzed, you no longer from non-GA, you can understand, we allow you to ambulate. Ambulate means to walk. You get out of the bed. Why? It will improve your recovery. So mother should ambulate. 2, the cesarean section that we do these days, it doesn't require you to go and wash it. There are no wounds. We cover you. People say we put plaster there and we close you such that you don't have even stitches. So you can go and take your normal shower. We advise someone to clean you, but you leave the place dry. A C-section heals in phases. So there is the first phase, we expect the mother to be accommodative, to move and be out of the hospital. Little could be 72 hours. Those are 3 days. Then from the 3 days, we allow the mother to be out of heavy duties for another 10 days, probably 2 weeks now from the time of operation. So from there, we allow her to go simple work, non-strenuous exercises for another 2 weeks. So we give a mother between 1 week to 6 weeks. That is 1.5 months. You are good to go. So when they operate you first Caesar and they operate you second Caesar, don't take it to be guaranteed that next Caesar is going to be simple. Every Caesar you go on, it gets adhesions, it gets scars, and the more scars you get, the more complication you come. But all in all, each Caesar is prepared differently. So you can go through a good Caesar, then the following will be hard, but the third one be good. So don't get worried as long as you prepare early.
Has been doctor's opinion as far as C-section is concerned. I'm glad you're still with us. We shall go for a brief break and we'll return with much more. Don't go away. This show is sponsored by Madagascar Nursery School. We are located on Entebbe Road, Kawuku Kachindu Trading Center. You can reach us on those numbers running on the screen. Madagascar Nursery School, nurturing amazing children.